Hi, thank you so much for coming in today. Please have a seat. I'm just going to go ahead and ask you a couple of questions and take some notes, and then we'll get started, okay? So first, can you go ahead and confirm your name and date of birth for me? Excellent. And so today I've got you down for having a full neurological examination. This is going to check the cranial nerves in your face, as well as some other thinking and critical thinking and reasoning functions of the brain. So if you have any troubles during the exam or any questions, please don't hesitate to ask, okay? Cool. So, before we get started, I'm just going to ask you a couple of questions. Just going to let me know that you're aware of your surroundings and that you're oriented to person, place, and time, okay? So first off, you already told me your name. Can you tell me where you are right now? At the doctor's. And how about what time of day it is? And what's the day of the week today? Almost the weekend. What about the time of the month? What month are we in? Do you remember what you had for breakfast this morning? And what about the year you graduated from school? Perfect. Can you tell me who the president is? I'm going to give you 3 words. I'm going to have you remember them, and I'll ask you again after we run some tests. So those words are lamp, blue, and cat. Can you repeat those now? Good. So just remember those. I'll ask you in a few minutes. And lastly, I'm just going to have you repeat after me. No ifs, ands, or buts. Can you say that? Great. Okay, so I'm going to start off with a couple of cranial nerves. So first off, are you having any trouble with smelling or tasting? Any differences in your smell or taste? Okay, I'm just going to go ahead and test your smell really quick. So go ahead and close your eyes for me. I'm going to put something underneath your nose, and I want you to tell me what it smells like. Was rubbing alcohol. So next I'm going to go ahead and check your visual acuity. So I'm going to go ahead and shine a light in your eyes. Do me a favor and look straight at my nose. Good. So I'm just testing for direct and consensual. Straight at my nose. I want you to look at the tip of my pen right here. I want you to follow it as I move it. Just move your eyes, not your head. I'm going to hold your head still right here. Just watch that pen, tip of the pen. Good. Watch it as it comes in. Follow it with your eyes. Excellent. Go ahead and look at the tip of my pen. Now look at the wall behind me. Tip of the pen, the wall behind me. Okay, very good. What were those 3 words that I asked you? Good. Yeah, that can be tough. That can be tougher than you think. That's why I distract you in the middle. Alright, so I'm going to go ahead and check some of the cranial nerves in your face. So go ahead and clench your jaw for me. Really hard. Good. Open nice and wide and close. Good. Good. No popping or clicking there as well, so that's negative for any T and J issues. Next I'm going to go ahead and have a little sensation test on your face. So go ahead and close your eyes. I'm going to touch you very lightly with this here. So you stick your arm out. See how that feels? Okay. I'm going to touch you with that very light touch on your face. Close your eyes and tell me when you feel it. Good. And the other side. Excellent. Okay, so you felt all of those. So that's good. It's telling me your sensation's intact. I'm going to just do something similar, but instead of that nice soft, it's going to be a little bit of a sharp tip here. It doesn't hurt if you stick out your hand. I'll show you. See how it's sharp, but it's not going to pierce your skin. It's not going to cause any damage. So go ahead and close your eyes again. I'm going to touch you, and I just want you to say yes when you feel it. And again, let me know if it feels sharp or if it doesn't. If for some reason it feels different. Okay. So does here feel the same as here? How about here? And here? And up here? And here? Excellent. Okay. Say the sensation of your face is intact. That's cranial nerve 5. Move on to some of your hearing. So I'm going to go ahead and make some soft noises by either one of your ear. Close your eyes and tell me left or right. Good. Good. That was both. Tried to trick you there. So hearing's intact as well. Okay. Next, I'm going to go ahead and check cranial nerve 7. So that's some of the symmetry and motion of your face. So can you go ahead and smile for me, nice and big? And then go ahead and frown. Good. And lift your eyebrows really high. And close your eyes really, really tight. Don't let me open them. Don't let me open. Good. Okay. Puff out your cheeks. And don't let me push them in. Okay. Alright, so it looks like there's good symmetry in your face. You didn't have any weakness or muscle wasting in your face, so I'm not too concerned about anything happening there with cranial nerve 7. Lastly, I'm just going to go ahead and check some of the strength. So I'm going to push down on your shoulders, and I want you to just resist me, okay? Good. And then could you put your arms up like this, and I'm just going to pull on them. Okay, and the other one? Good. And I'm going to have you put your hands back like this. I'm going to try and pull them away. Don't let me. Okay? And then just your thumbs like this. And same thing. Don't let me push them. Good. Okay. Upper body strength's intact. Do a couple things with your fingers. I want you to move them back and forth, touching each finger, just like this. Excellent. And can you push your thumb all the way over to the inside of your hand? Good. Okay. I'm going to have you take your pointer finger and touch my finger and follow it everywhere it goes. So touch it here. Okay. Good. And just keep touching my finger wherever I move it. Good. Okay. Any difficulty with that? Right. I'm going to have you take your hands and do some rapid movement. So I want you to flip them over as fast as you can. And you can do it right on your thighs. Good. Perfect. Okay. I'm going to go ahead and test some of the reflexes in your arm. So if you can let your arm out like this, nice and floppy, I'm just going to grab it. Good. And the other side, please. Good. Okay. I'm going to do the same thing just with your wrists. So go ahead and give me all your weight, all your weight. Good. And on this side, all your weight. Good. Go ahead and let your jaw hang. I'm just going to tap it very, very gently with the reflex hammer here. And if there's any pain, please let me know. So nice and gentle, nice and gentle. Good. Okay. No issues there. You stick out the palm of your hand. Good. I'm just going to stroke it with this little part of it. It's a little bit sharp, it's a little uncomfortable, but it's not going to hurt you. Okay, ready? Give me your hand. Thank you. Good. And the other one? Just place it in my palm. Good. Okay. So the next thing I want to do is I'm going to just refer to the chart. So you said you were having headaches, correct? Okay. And were the headaches more in the front or the back of your head? Kind of like, okay, kind of like all over. And is it a radiating pain or shooting pain, sharp pain, or dull ache? Okay. And on a scale from 1 to 10, 1 being no pain at all, and 10 being the worst pain you've ever had in your life, where would you say the headaches are usually in general? Okay. And do they tend to happen at any certain point in the day? In the mornings, the evenings? Okay. And is there anything you do that makes it better? Resting. What about anything that makes it worse? Okay, yeah. It's pretty common if you have migraines that, bright lights or loud noises could irritate that for sure. Okay. I'm just gonna feel your head for any lumps or bumps or anything that might be causing that pain. So just stay still. Any pain in your ears here? No? Okay. Just gonna feel down your neck and your traps. Feel for any tenderness or pain. Okay. Did that hurt at all there when I was palpating you? No. And in your head as well was okay? Okay. Have you noticed that anything triggers these headaches at all? Like reading computers and stuff. Yes, we definitely all spend a lot of time looking at screens. I just want to look a little bit deeper into your eyes, since it may be coming from that. So you can go ahead and just look at behind me at the wall, and I am going to get very close, so I do apologize, the light is going to be bright, but I just want to look at the back of your eyes. I'm going to try the other one. Okay. I'm going to take a look at the pupil size here. Okay. Your pupils are just a little bit dilated. That could be because of the light in the room is bothering you. Let's make a note of that. I also want to test a little bit more sensation. So, feel this on your arm like this. Feel that? Does that feel cold or warm to you? Cold. Okay. I'm just going to touch it against your face in a couple of spots and tell me if you feel any difference between it, and tell me if it feels cold. Okay. Okay. And on this side, any difference? Any difference? The same both sides. Okay. So I especially wanted to check that around your eyes to see if there was any sort of radiating pain behind the eyes that was also causing some issues with sensation. I didn't notice that at all. So what I think is probably happening here is not neurological. All your neurological senses seem to be intact. You're able to produce memory and some quick rapid movements, which shows me that your neurons are firing normally. But I would say that I did see some abnormalities in your eyes, and it could be that you're having some eye issues that are causing some headaches. So I am going to go ahead and refer you out to my colleague. And, she's going to go ahead and look at your eyes. But I do think that, it doesn't strike me as any sort of lesion in the brain or any issues with that, okay? Okay. All right, well, thank you so much for coming in today. It was great to meet you, and I hope you feel better soon.